Hey everyone, and welcome to The Explainer. Today we're unpacking a topic that is incredibly complex, yet deeply, deeply personal: the therapeutic toolkit used to treat addiction. You know, when someone enters recovery, there are so many clinical terms thrown around, but it's rarely explained how all these different therapies actually work, let alone how they work together. Well, today we're going to break the whole thing down.
So, let's start by addressing the absolute biggest question on anyone's mind when starting recovery, because finding that right starting point, it can feel completely overwhelming. Picture this: you or a loved one are stepping into treatment, and you're just handed this massive pamphlet of options. You're left wondering, where do I even begin? Do you need to sit in a circle with total strangers and share your story? Do you need to bring your parents or your spouse into a room to hash out old conflicts? Or do you just need intense, one-on-one time to process your own internal past?
To answer that, we first have to understand that addiction doesn't just affect one single part of a person's life, right? It is a multifaceted, systemic problem. It impacts your household, your social connections, and literally the very neurochemistry of your brain, changing how you process rewards, memory, and stress over time. And because that damage happens on so many interconnected levels, it requires an entire toolkit to heal. There is absolutely no single magic bullet therapy. Instead, we use diverse, highly specialized tools to treat the different layers of the individual.
To do that, here is our roadmap for today. 1. The Addiction Therapy Toolkit. 2. Family Therapy Healing the System. 3. Group Therapy Power in Peers. 4. EMDR Rewiring Trauma Responses. 5. Comparing your therapy options. And finally, 6. Building your recovery path.
All right, let's dive right into Section 1, the Addiction Therapy Toolkit, moving from macro to micro.
And that brings us to Section 2, Family Therapy, Healing the System. This is our macro ecosystem.
To start our journey from the macro level down to the micro, we really have to look at the broad ecosystem, recognizing that addiction is, for sure, a family illness. When one person is struggling with substance use, every single person in that household adapts to it. Think of this like adjusting the lens on a microscope, starting super wide. Now, family therapy isn't about blaming the person with the addiction. Rather, it's about having all members of the family come to the table and take 100% responsibility for their part in the dynamic. A great example of this is a therapist non-judgmentally redirecting a loved one from enabling behavior to actual healthy support. Family members often come into therapy feeling guilty, angry, or overengaged. They might financially support the individual thinking they're helping when they're actually enabling. And enabling is basically when trying to save someone actually protects the addiction instead of the person. So a licensed therapist steps in to carefully untangle that, shifting the communication from blame to empathy and structure.
If your household is experiencing frequent arguments, total avoidance, a complete loss of trust, or that financial enabling we just talked about, a licensed professional can guide you through 60 to 90-minute sessions to rebuild those boundaries. Because when there's mistrust in a family, it creates a terrible cycle. The person in recovery doesn't feel trusted, which triggers their urge to use, which in turn creates more mistrust. Let's say a parent constantly checks their adult child's phone out of fear. In a session, a therapist is going to help them build a concrete, healthy boundary instead, perhaps agreeing to random drug testing, but leaving the phone alone. This gives the parent peace of mind while restoring the adult child's dignity. Family therapy identifies these deeply ingrained maladaptive patterns and literally stops the cycle in its tracks, so the whole system can heal.
Let's move on to Section 3, Group Therapy, Power in Peers. This is the intermediate community.
Now we adjust our microscope lens to zoom into the intermediate circle, moving away from the family unit to look at how an individual interacts with a broader community. And this is where the contrast between these tools really becomes crystal clear. While family therapy is entirely focused on untangling messy, historical baggage with the people who share your past, group therapy offers something fundamentally different. It gives you a safe, judgment-free space to practice vulnerability with strangers who have absolutely zero history with you. Think about the intense anxiety of facing family members you may have hurt versus the profound relief of sitting with peers who are walking the exact same path. In a group, you don't have to worry about disappointing a spouse. You find instant validation from people who understand you because they're fighting the exact same battles. So, in short, family therapy is about accountability for the past, while group therapy is about building shared strategies for the future.
Inside these groups, which also run for about 60 to 90 minutes and are led by licensed pros like clinical social workers or counselors, the work is highly practical. You aren't just sitting around talking, you are literally skill building. You might use cognitive behavioral therapy, or CBT. CBT is essentially learning to catch and rewrite those negative, automatic thoughts that lead to destructive actions, stopping the downward spiral before it even starts. You'll engage in trigger mapping to identify people or places that increase your risk of relapse. You even do intensive role-playing exercises. I mean, imagine practicing exactly what to say when an old friend offers you a drink at a wedding, or rehearsing how to manage a panic attack in a safe, controlled room long before you have to navigate those high-stakes situations out in the wild.
Which brings us to Section 4, EMDR, Rewiring Trauma Responses, the micro-internal landscape. Now we zoom all the way into the individual's mind, the true micro level. We've looked at fixing the family system and building a peer community, but now we have to address the deeply personal, internal wounds that so often fuel addiction in the very first place. When a traumatic event occurs, stress hormones like cortisol and adrenaline just flood the brain. This chemical flood completely shuts off your brain's natural ability to process memories appropriately. So your brain basically gets stuck in a fight-or-flight response, acting kind of like a skittish deer. Because the memory is unprocessed, you feel the physical anxiety and panic as if the trauma is still happening right now, today, which frequently drives a person to use substances just to find some relief. To compare this to our previous tool, if group therapy teaches you how to handle the deer when it gets scared, EMDR is about treating exactly why the deer is so scared in the first place.
This is exactly where EMDR, which stands for eye movement desensitization and reprocessing, works its magic. When you sleep and enter REM, or rapid eye movement sleep, your eyes dart back and forth, which naturally triggers the part of your brain that processes the day's memories. EMDR uses bilateral stimulation to safely mimic this REM sleep cycle while you're wide awake. What does this actually look like in the room? Well, the therapist might have you track their finger back and forth across your field of vision, or they might have you hold small buzzers in your hands that alternate vibrations left and right. This alternating stimulation essentially jump-starts that blocked processing mechanism in your brain, allowing you to finally safely process the traumatic memory properly.
After a typical course of 6 to 12 sessions, patients often notice a massive physical and emotional relief. The emotional intensity of the traumatic memory just drops. You can look back at the past without your body going into a full-blown panic response. And by unlinking the trauma from the intense emotional pain, you simultaneously unlink it from the urge to use substances to cope. This has a massive multiplier effect on your recovery. Once that trauma is unlinked and your nervous system is finally calm, participating in family therapy or group therapy becomes exponentially easier because you aren't fighting a constant internal battle while trying to connect with everyone else.
All right, let's pull it all together in Section 5, Comparing Your Therapy Options, the Grand Comparison.
When we put these side by side, the distinct role of each tool becomes incredibly clear. Look at the targets. Family therapy addresses systemic household dysfunction. Group therapy tackles isolation and builds active coping skills. And EMDR goes straight after unresolved individual trauma. Notice who's in the room with you, too. Family therapy involves your loved ones. Group brings in peers facing similar struggles. EMDR is strictly one-on-one. Finally, looking at average out-of-pocket costs, using Texas without insurance as our benchmark, group therapy is the most cost-effective at $40 to $150 a session. This is because the costs are shared among several participants or bundled into a larger program. Family and EMDR therapies, on the other hand, are highly specialized, singular-focused treatments, which is why they usually range a bit higher, between $100 and $300 for a single session.
But thankfully, the financial barrier isn't always as scary as those out-of-pocket numbers suggest. Because of mental health parity laws, which basically mean insurance companies are legally required to treat mental health coverage just as seriously and comprehensively as physical health coverage, major plans typically cover these therapies if they're part of a structured treatment plan and deemed medically necessary. Group therapy is very commonly bundled right into the cost of an intensive outpatient program, making it highly accessible. And for specialized treatments like EMDR, your insurance might just require a prior authorization from your clinician before you begin.
Let's wrap things up with Section 6, Building Your Recovery Path, putting the pieces together.
We've seen that treating addiction isn't about picking just one approach and hoping for the best, right? It's about utilizing the right tools at the right time. Addiction thrives in isolation and unhealed wounds. So, as you look at this toolkit, I want you to ask yourself, will you start by breaking the isolation in a group, untangling the past with your family, or finally confronting the wounds in your own mind? The right tool is simply whichever one gets you to take that very first step. Thank you so much for joining me on this explainer. Keep learning, keep growing, and I'll see you next time.